Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of the show. All of your questions are important to us, and we want to answer as many as we can for you. An 82-year-old man from Sioux Center, 10 years ago, shoulder replacement done, very successful, but in the last week or so, shoulder pops and cracks when he's moving. What causes this and what's going to happen?
A lot of things could happen. The worst thing could be that the glenoid, the new socket, has gotten loose. That's the most common mode of failure in a total shoulder replacement. I encourage all my patients after I've done shoulder replacement, if something changes like that, to come in and see me and get an x-ray. You can usually make the diagnosis on the x-ray. So with a shoulder replacement, we remove the ball, take that thing and get rid of it, and then replace it with a new one that's attached to a stem that goes down into the humerus like that. So here's our new ball here. And the other part of this is the socket. And there's a new plastic socket typically, although some of them are metal backed, and they have posts usually, or sometimes a keel that goes into the scapula of the shoulder blade, and then that's cemented into place with a special bone cement. And total shoulder replacement is a great operation, but sometimes that socket can get loose and cause popping, cracking, and pain. So I'd get in and get an x-ray.
Okay. We have a 77-year-old man from Elkton. What can be done to straighten out my broken pinky finger? Dave?
Yeah, so if it is recently broken, it's a relatively simple problem.
Pinky meaning the little...
The small finger, yeah.
Yes.
So oftentimes we're able to just straighten it out and hold it with some pins that just go through the skin that stay in for a few weeks. If it was broken years ago, that becomes a little bit more complicated, and then the problem depends if it is bent through the joint because it's stiff, or if it's bent through the bone. If it's through the joint, we try a variety of different splints and therapy to try to get it straightened out.
But
again.
if you can't and you had to fix it, do you fix it in this physiologic curved position?
We do, yeah. So people oftentimes wonder about where their fingers should be pointing, and in general, they all point to a spot right on the base of the palm there. So some overlap is normal of the fingers. We talk about a normal finger cascade. Certainly if the finger is sticking out to the side, especially the small finger, that can get in the way and cause problems.
Okay. 88-year-old woman from Watertown, what's causing the aching in the knees after the knee replacement, and what can be done?
Not uncommon for people to have still some symptoms after knee replacement. 5% of patients at a year after knee replacement surgery are not happy with their new knees, but that means 5%. Yeah, 5%. But that means 95% are very happy. Even in those 95%, though, a lot of them still have some symptoms. It can be tendonitis, it can be stiffness, it can be deconditioning because they don't have the quadricep strength that they need. I would recommend that she quickly go see her surgeon, get it evaluated. He'll probably have an answer for her.
Makes a point of the value of pre-surgery exercise. Tell me a bit about that.
I don't think you can overestimate it, Rick. You know, your segment, your discussion about orthopedics, the importance of staying active. Whenever I'm considering significant orthopedic surgery on one of my patients, we usually develop a program of prehab, preoperative rehabilitation. Try and get that patient's joints and muscles in as good a shape as possible before we do the reconstruction.
So I'm going to be an older guy and I want to do exercises to stay strong so that if I ever do get into trouble, I will have strength to be able to work on it. But shoulders is the biggest worry. You talked about the danger of wearing out a shoulder. What exercises should I be doing at 66 to prevent problems later on?
You can break those exercises into two parts. One part is rotator cuff strengthening exercises. Therabands, light dumbbells, working on internal and external rotation of the shoulder, abduction, and flexion. And the range of motion does not have to be extreme. You don't have to take it all the way up above your head. Just work the muscle in its pain-free range of motion. Secondly, the big muscles across the shoulders, your pecs, your traps, your deltoid, your bis, your tris, your lats. And those you can do in a variety of different ways, usually at a health club. They've got all the machines you need to do those. I would say in general, light weights, more reps, concentrate on range of motion, function. Don't try to look like He-Man.
Okay. Like you do. Oh, wow. Wow. 71-year-old from Kyle. His left hand feels like there's sandpaper in them whenever he moves his fingers. He's wondering what causes this, and he's diabetic. It feels like sandpaper when he's moving them.
Yeah, certainly with his history of being diabetic, it makes you wonder about a peripheral neuropathy where all the nerves are affected. And it certainly can be a problem where a nerve is pinched, but I would wonder about whether or not it's more of a generalized peripheral neuropathy.
What about hand exercises to prevent deterioration of my hand as I get older? I mean, do you recommend anything?
There's very little data that there are any exercises you can do in your hand to prevent problems. There's one small study looking at some exercises to prevent thumb arthritis.
Yeah.
Where you literally just push against the side of your finger to strengthen this muscle right here.
Oh, really? Push
Towards your thumb. Push towards your thumb.
So that will help with the thumb arthritis?
Helps to stabilize the base of the thumb. The data is weak, but I tell people if you want to do something to try to prevent thumb arthritis, push against your finger.
What about the golfer's squeezer thing?
Yeah, those are fine. They keep the joints limber, but again,
no data.
Lighter weight. You don't want to do real forceful gripping because that can just increase the force across the joints.
All right. 65-year-old woman from Brookings, after having a knee replacement, the patient had a rash develop around the incision. Rash is still present weeks after surgery. Rash after surgery.
Yeah, I think it was my patient. She's calling in because she's still not perfectly happy, right? Usually that rash right around the incision is from something in the dressing that we put on there, or it can be what we use to prep the skin before the surgery. In general, as soon as we can, we like to get everything off the skin, leave it open to the air, might have them use over-the-counter hydrocortisone cream or another steroid cream to try and decrease the rash. Benadryl orally for itching, or there's a Benadryl cream they can use now too.
And I would add, I like CeraVe, and the reason CeraVe is nice is because after you take a shower, after you wash, because oftentimes rashes are dry, too much washing, right? So you take your shower, you put the CeraVe on top, it caps the water inside. It's sort of like zinc oxide ointment, only it's pleasant. So Cera, capital V, or any other of the creams that have ceramide in them. What about ways to reverse hammer toe? Are there exercises to reverse it?
Not aware of any exercises. There is surgery that can be done to straighten
surgery,
toes.
Pretty straightforward surgery. If it's bothering you, that's the major.
Exactly.
70-year-old woman from Rapid, total shoulder replacement surgery coming soon. Will I have a total recovery, or will I have to exercise to get my range of motion back? How long will it take?
Yes, and yes.
And yes. Yes, you will have.
Obviously you're having the surgery because you're not happy with the current situation. We expect that the surgery will make you much better. Less pain, better range of motion, better strength, better function. You definitely will have to exercise to get to where you want to go, though. It's not just going to happen on its own. How long? I tell my patients who I'm doing shoulder replacement surgery on to expect improvements for about 2 years. Their shoulder has been getting bad for 20 or 30 years. It's impossible that it's going to get better in 2 or 3 weeks. You're going to have to keep working on it, and you'll slowly gain range of motion, strengthening, endurance, stamina, and get the shoulder back the way you want.
But you want to do preoperative exercises, so get strong, always. 65-year-old man from Wilmot. He is calling for his brother, who is a Vietnam vet, 62 years old. They operated 6 times, got a bad infection. They removed his hip joint. He's not had a hip joint for 5 years now. The doctors are now just prescribing him pain medicines. Can something like this be repaired? Except that he doesn't have the musculature to use that hip anymore, does he? Or does he?
Well, yeah, I think that's a difficult problem. Infections with joint replacements are one of the things that we worry about most, and there are times where, despite everything we do, we're not able to fully clear that infection as long as there's metal in the body. So I think it's worth getting another opinion to see if putting a hip joint back in is an option. But it sounds like he's been through this several times.
That's a tough scenario.
We've got a partner. David and I have a partner down in Sioux Falls at Orthopedic Institute, Dr. Corey Rothrock. Corey is he's an orthopedic surgeon like we are, but he's fellowship trained in orthopedic oncology, which is cancer of the bones and joints. Those guys are also the experts in bone and joint infections, and there aren't a whole lot of them. He's the only one in our region. this is a tough problem. If this was my brother, I'd get him in to see Dr. Rothrock.
Yeah, I've had great experience with Rothrock because I've seen these horrendous cases. They all seem to gravitate to Rothrock, and he'll take them.
Oh yeah,
he takes them.
He loves them.
So anyway, 71-year-old man from Sioux Falls is restless. Oh, I've got to type. Let's see. Restless leg syndrome related to an orthopedic problem. So restless leg syndrome. Any comments?
I think it's unrelated to an orthopedic problem. It can be a iron deficiency problem or just a neurologic problem is most common.
We've got a 74-year-old man from Sioux Falls related to an orthopedic problem, so restless leg. That's it. All right, now I need to go to the next one, and I'm having trouble with my machine here. You tap it. 57-year-old woman from Kennebec, if I can get there. Here it is, had a cancerous wart taken off of the palm of her hand. She now has a lot of scar tissue. Would scar tissue removal surgery be as painful as the wart removal, and would it improve hand function? What do you think of that?
Yeah, so difficult to say without seeing the hand. When we hear about people with a lot of scar tissue, Dupuytren's contracture is one of the things that we think about. They are more prone to forming thick scar. So if she has formed thick scar once, it is certainly possible that it would come back, but would have to see the hand to know for sure if there's ways to improve that.
86-year-old woman from Brookings. Constant tingling in the tip of her fingers and random numbing of the hand. What is causing this, and what can I do about it?
Sounds like carpal tunnel syndrome. So the thing to do is to get checked out to
see if it, and don't let it go too far.
Don't let it go too long. Exactly.
83-year-old man from Central with knee pain when standing or walking, not at rest. What is the most likely cause of this pain? Had minor back surgery 10 years ago, 5'11", 205 pounds.
Osteoarthritis.
And so, what do you recommend?
Evaluation and treatment.
And probably the treatment's going to be?
It depends on how severe the arthritis is, but almost always we start with non-surgical management, medications, physical therapy, home exercise program, injections if needed, surgery as a last resort.
Okay. 30-year-old woman from Vermilion had trapezium implants and now is breaking down. What can I do about this, trapezium?
Yeah, so that's the bone at the base of the thumb.
That's the one that really is, it loses its blood supply when it fractures, and then it gets necrosis.
That's the scaphoid.
Oh, that's the scaphoid.
Yeah, the trapezium, it can happen in the trapezium, but more commonly that's the scaphoid. Trapezium implants is a work in progress. There are newer implants that are out, but I think the treatment for this is to remove those implants, and what we're doing more commonly is just using tissue from the body to support the thumb. And so if we
what is the trapezium?
Here, so at the base of the thumb, this is the trapezium right here. And this is the joint between the trapezium and the metacarpal here where people most commonly get arthritis. And so there have been several different types of implants that have been developed, trying to develop a joint replacement for arthritis at this joint. Some of them were silicone, and if this was 30 years ago, my guess is that is silicone. That silicone eventually breaks down. What we do is we remove that bone in its entirety. We use a tendon from the forearm to create a cushion or sling at the base of the thumb here to support the thumb metacarpal.
So it's time for her to have another surgery.
Time for her to have a new surgery.
76-year-old woman from Sioux Falls wakes up at night with pain in the knees and hips, but doesn't occur during the day. Heat pad, pain goes away. What's causing this?
This is most likely soft tissue pain, not joint pain. Most common thing would be iliotibial band syndrome, usually treated well with physical therapy modalities.
And why did she have it? Iliotibial band is where? Let me see if I can find the knee, right?
The IT band or iliotibial band runs from the hip joint. So way, way, way up here, right, is the hip joint. or the iliac wing above the hip joint, and the IT band runs all the way down the outside of the hip, the thigh, and comes down, actually attaches way down here on the tibia right here. It's an incredibly long structure, crosses two joints, the hip joint up here and the knee joint down here. As we age, and especially if we don't rigorously stretch that structure, it will tend to get tight. And as it gets tight, it will want to rub up here at the hip joint and down here at the knee and cause pain. It's usually relieved with heat and stretching and with movement, actually. So that's why she has it at night or when she's at rest, and especially if she then changes position or gets up to go. But once it gets stretched out and warmed up, the pain goes away.
All right. This is, the next one is an 80-year-old woman. Let's see. I'm trying to get this. An 80-year-old woman from Sioux Falls. What can be done for osteoporosis?
If she was my patient, I'd send her to see you.
Yes.
What do you do for osteoporosis?
You don't get there because you've been exercising. It's, you know, I would make this point that osteoporosis is a disease of thinning of the bones. You want to make sure that that person has adequate vitamin D, and that person doesn't have malnutrition of some kind, and that person, you know, if you look at an X-ray, you'll see the lines in the bone that go through the bone, and we call that stress lines because they come from a lifetime of pounding on it, making the bone stronger. So it's exercise or that makes bones stronger, lack of exercise, and they get real soft. I think we have thought that there's medicines that help, and there are medicines that help, but they're a weak alternative to the most important thing, and that is a lifetime of walking. Would you agree?
Yeah, for me, personally, and my family, I recommend regular weight-bearing exercise, walking, or getting in the gym and doing a little bit of weight training. Make sure you've got adequate vitamin D and calcium intake. But sometimes, Rick, you've done all those things and the patient still has profound osteoporosis. Do you have a first-line medical agent that you like to use for those patients?
You know, I'm in a quandary right now because the drugs, and there's 4 or 5 of them that you can use to make the bone stronger. But now we find that at 5 years, gee, they're starting to have small fractures, and so they've said stop them and give them a rest. And then really the answer is we don't know what we're doing with those. We don't know what we're doing with that one. There's this other one that you take an injection twice a year. And it's theoretically probably a reasonable option, except that it's a biologic. It's a big time thing, and I haven't gotten on board with that one. So my answer is always to just keep exercising, and when you're 80 or 90, you know, exercise is important, and if you get severe osteoporosis, it's kind of what's been handed you. It's a familial deal more than anything. Yeah. Well, I think we're out of questions. It was a great night. It was a fun, quick snap through the work, and we appreciate you being here and answering our questions.
Thank you.
Thanks for having us.
Very fun.
Thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. And until next time, stay healthy out there, people.